Hi everyone, this is Dr. Ina. How are you? I pray that everybody doing well, successful in your study. Let's study together. Today is Saturday, March the 28th, 2026. Let's study about PHAM again. This is medication that affect your CNS and PNS, central nervous system and peripheral nervous system. So it will be including medication for sleep, insomnia, anti-Parkinson, antipsychotic, antidepressant, anti-seizure, and anti-anxiety. Every time when you answer your test question, don't forget your strategy. Assess, 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 right? If there are 3 answer intervention and 1 assess, choose assess, right? And the opposite, if there is 3 assessment and 1 intervention, maybe the answer is the one that intervention, right? When life-threatening, when you already have enough data, then intervention. Make sure you know what is the indication of the medication, what is the medication for, know the contraindication, know the side effect. Side effect is normal, right? If I eat acetaminophen and I'm sleepy, that's the side effect. And also know your adverse effect, very important, right? The toxic effect, something that I don't want it to happen. So if you eat Tylenol, acetaminophen, and now your skin yellow, your sclera yellow, right? That's already affect the liver. So that's the adverse effect. So you have to stop and report to doctor. Let's talk about Zolpidem. This is your sleeping pill, right? Ambien. Trade name is Ambien. So Zolpidem to make the patient can sleep, okay, to treat insomnia. But when doctor orders Zolpidem for the patient, we have to monitor, make sure there is no respiratory distress, right? So monitor respiration and no complex sleep behavior. What does that mean? They sleep driving, they sleep walking, right? Very dangerous, sleep driving, right? If this happen, of course, they have to report to doctor, right? Doctor will tell them to stop the medication and give them something else, right? Because now they already sleepwalking, sleep driving, probably because of the adverse effect of the Zolpidem. Possible they have hallucination, they see something, smell something, taste something, hear something, right? So if they have that, doctor will change the order. And then maybe they have physical or psychological dependence. So if they don't take the Zolpidem, something can happen, right? So tell them to report to doctor. So those are adverse effects that you have to watch when the patient use Zolpidem. Chlorpromazine. What is your chlorpromazine? This one always in the test, right? Make sure you remember your chlorpromazine is one of your antipsychotic. Chlorpromazine, antipsychotic. And this antipsychotic chlorpromazine, don't give it together with anti-Parkinson. Okay? Don't give it to people that use anti-Parkinson, people that Parkinson. It's contraindication. Why? Because then it high risk for QT prolong. You see the normal EKG, you have QRS and you have T, right? QRS is your ventricle contraction, depolarization, systole. And then the T is your ventricle relaxation. Usually this is the normal QT, right? And now if they use the medication, possible it prolong the QT. So it take longer time for the ventricle to contract and relax. You see the ST segment become so long, right? The ST segment, it's still isoelectric, but too long. So it take time for the ventricle to contract and relax, repolarization, right? So careful, anti-Parkinson and chlorpromazine can be a problem, right? Because it high risk for QT prolong, so you have to monitor EKG. If doctor give chlorpromazine antipsychotic for this Parkinson patient that take anti-Parkinson, monitor the EKG. QT prolong. Risperidone, right? Usually we use risperidone for children. Out of all antipsychotic, it's safe for children, right? But still we have to watch out. So this is your antipsychotic for schizophrenia. But be careful, if doctor give risperidone, we have to watch. Adverse effect can be cardiac dysrhythmia. So do your EKG, right? Stephen-Johnson syndrome. So the skin have a lot of bullae, right? Bigger than vesicle with the fluid inside. That's scary. And then agranulocytosis, WBC low, they risk for infection. So you have to monitor for the white blood cells, CBC, sign and symptom of temperature, sign and symptom of infection, right? Check their temperature because WBC low acts for sore throat. This is Risperidone. And the scary part is the tardive dyskinesia. They smack their lip, make noise with the tongue, right? And extrapyramidal syndrome. This is look like Parkinson. We call that pseudo Parkinson. We call that Parkinsonism because look like Parkinson. So they have tremor, they have muscle stiffness. So if you see this with the patient that take this antipsychotic, of course report to doctor, right? And the worst is neuroleptic malignant syndrome, where the vital sign go up very, very high. If the BP very high, they can have stroke. If the temperature very high, the brain damage, right? So what's this? If your patient receive antipsychotic, risperidone, right? I don't want cardiac problems, Stephen-Johnson syndrome, agranulocytosis, they have infection, right? I don't want tardive dyskinesia, smack the lip and make noise with the tongue, extrapyramidal syndrome, they look like Parkinson, they need anti-Parkinson medication, right? And the worst is neuroleptic malignant syndrome. Vital sign go up very, very high. Alright, now let's talk about fluoxetine. Fluoxetine. What is fluoxetine? This is also one of your antidepressant. Okay, antidepressant SSRI, selective serotonin reuptake inhibitor. I inhibit you to reuptake my serotonin, right? Because if the serotonin low, the patient depressed. So this medication to inhibit reuptake of the serotonin. So your fluoxetine. We use for bipolar antidepressant. But when we use fluoxetine, we have to monitor for suicidal thought and behavior. Serotonin syndrome means they have too much serotonin. That's why we don't give fluoxetine with other meds, right? Never ever give antidepressant with your don't give the SSRI together with MAOI because they can have serotonin syndrome. Means they toxic with serotonin, right? Muscle rigid, fever, tachycardia, right? That's what you have to monitor and report if you see that. And usually this happen because they take other medication together, right? Very dangerous cardiac problem, torsades de puente, worse than VTAC, ventricular tachycardia, right? And then QT prolongation. So the QT, the ventricle contract and relax take longer time, right? Neuroleptic malignant syndrome can happen also, even though this is antidepressant, right? Vital sign go up very high, and they can have seizures and bleeding. Of course, we have to report to doctor if we see our patient seizures and bleeding, right? Monitor their EKG. I don't want any serotonin syndrome. Suddenly they have muscle rigid, fever, tachycardia. I will report to doctor, right? For fluoxetine. So it's antidepressant. Now talk about Venlafaxine. Venlafaxine. The medication have FAX, fax in the middle of the name of the medication, right? So if you see medication with fax like this is your antidepressant, but it's SNRI, not SSRI, but SNRI, norepinephrine. Okay, N is norepinephrine. We also can use this for bipolar. It's your antidepressant also. And remember, may not stop abruptly. Do not stop abruptly for this, right? This is your antidepressant, cannot stop abruptly. So when the patient have this medication, monitor the adverse effect. They can have suicidal thought. Don't let them kill themselves, right? Serotonin syndrome again, too much serotonin. Don't mix with other meds. Headache, agitation, confused, hypertension, tachycardia, so all the vital signs go up, muscle rigid, right? Serotonin syndrome. Neuroleptic malignant syndrome also can happen, very bad, vital signs go up also, right? Seizures, induction of acute manic episode, possible they take the antidepressant, but then it worse, the acute manic episode. Unexpected bleeding, altered platelet, that's why they bleeding. Anaphylactic shock can happen, agitated, confused, chest pain. Of course, I will report to doctor, right? Hypertension, palpitation, tachycardia. So many of these medication can suddenly make the vital sign go up. If you see that, you have to quickly report to doctor. Be careful, you cannot stop the medication abruptly, right? Teach the patient they cannot stop the medication abruptly without consultation with doctor. Alright, now let's talk about Bupropion. Bupropion, always in the test. Bupropion. What is this Bupropion? Usually we use it to stop from smoking, right? So smoking deterrent. This is actually antidepressant. Okay, Bupropion, antidepressant. Usually people use to stop smoking. But then be careful if they use this, possible they want to kill themselves or kill other people, right? What's that one? Adverse effect. And then seizures. So if you have patient with electrolyte imbalance, maybe they vomiting, they diarrhea, colostomy, jejunostomy. So if they have a possible electrolyte imbalance, don't give them Bupropion. Okay, because the adverse effect can be seizures for people with the imbalance with electrolytes, right? Of course, I will not give to the patient that hypersensitive, serotonin syndrome again, right? Don't give it with other meds, heart block, syncope, cardiac arrest. So you need to check their heart, their EKG. Okay, it can be blocked in the FE block. They can fainted and they can have a cardiac arrest. The heart stop. So this is Bupropion when people use this to stop smoking. Careful with adverse effect. Teach them about adverse effect. Trazodone, number 7, right? Trazodone. This is one of your medication that we use a lot in nursing home to help the patient to sleep. But actually this is antidepressant, right? So it make them sleepy. That's why I give it at night. So this is also antidepressant, right? Many elderly, they lost their loved one, they depressed, so they got Trazodone. But if you use Trazodone for the patient, assess their EKG, right? Check their EKG. This one also, they can have suicidal thought, serotonin syndrome also can happen, don't mix with other meds, right? And then there you go, QT interval prolong, right? So Trazodone also can cause QT interval prolong. So the ventricle contract and then relax, it take longer time. And what is the sign and symptom to the patient? Dizziness, irregular heart rate, right? Fatigue, they're very tired. So that can be a sign and symptom when they have QT prolonged. They can have torsades de pointes, so really bad. The ventricular tachycardia, worse now, right? Torsades de pointes. Priapism can happen. So this is erection for hours, maybe 6 hours, right? Priapism because of the Trazodone. It's very painful for the guys, right? And then possible visual hallucination report, right? So what's this? And you don't want to see this adverse effect with Trazodone. Don't forget, check the EKG, right? EKG, it affect the heart. Prolonged QT, torsades de pointes, okay? Possible for priapism for Trazodone. Erection that more than 6 hours. Very, very painful. Can be effect from Trazodone. Amitriptyline. Amitriptyline is your TCA, tricyclic antidepressant. Memorize that, right? Tricyclic antidepressant, because you have antidepressant that MAOI, TCA, St. John word, right? But this one is the one of your TCA, tricyclic antidepressant. Amitriptyline, Elafil, to elevate the mood, right? But be careful when I give this amitriptyline, they will have orthostatic hypotension because this is anticholinergic, dry, right? So that's why they can have dizziness, sedation, right? Don't drive the car. Lethargic, blurred vision because of the dry eye, right? Dry mouth also, constipation, weight gain. Okay, this is all the effect of the anticholinergic. That's why this is side effect. It's normal, it's common. We tell them if they take this medication, this can happen, right? Orthostatic hypotension, dizzy, sedation, lethargic, blurred vision, dry mouth, constipation, weight gain. So teach them, get up slowly, increase your fluid, right? Because this medication will cause dry. So drink a lot of fluid, and when you get up slowly, risk for fall. So amitriptyline, okay? Adverse effect, dysrhythmia, so also monitor their EKG. Now they have irregular heart rate, torsades de pointe, really bad, really dangerous, suicidal thought also. So many of these antidepressant, antipsychotic, careful, okay? The adverse effect, suicidal. And then also possible glaucoma, the intraocular pressure go up, seizures at the high dose, so don't take too much, right? Follow the prescription from doctor. And then bone marrow suppressed, now they risk for infection, right? When bone marrow suppressed, they have anemia, they also risk for bleeding, their white blood cell also problem, so now they risk for infection also. Okay, so amitriptyline, your antidepressant, TCA, tricyclic antidepressant. Anticholinergic effect, dry. Careful, check EKG. Sumatriptan, famous medication, right? I use Sumatriptan for migraine. This is your migraine medication. Vasoconstrict, right? When somebody migraine, their blood vessel dilate. Don't forget, I also can use methyl ergonovin maleate for migraine, right? Something that vasoconstrict. But be careful when I give something that vasoconstrict, I have to monitor blood pressure, right? Vital sign, they can go up. So this Sumatriptan for migraine. Side effect is drowsy and fatigue. Don't drive the car, right? So drowsy and fatigue, very tired. And adverse effect, if they complain the chest feel tight, right? Of course, they have to report to doctor, stop your Sumatriptan, right? If they feel the chest pressure and then the hand also, right? Tight, dizzy, it can progress to angina pectoris, right? Angina is the chest pain that go away after they rest or nitro, correct? So assess their vital sign and report to doctor. Don't stop the medication because maybe that chest pain come from the Sumatriptan. It's vasoconstrict and now too much, right? The CNS effect can happen, tingling sensation or vertigo. So if they have this tingling sensation or they have vertigo, of course report to doctor. It can be because of the adverse effect of the Sumatriptan. Next, Lorazepam. Lorazepam is your Ativan, right? Diazepam is your Valium. So your Lorazepam and Diazepam, they are your benzodiazepine, right? So Lorazepam, Ativan. Pam, usually sleepy. Give it at night because they sleepy, okay? So Ativan, this is one of your benzodiazepine. If somebody toxicity with Valium or Ativan, give them flumazenil romacicon. Know this name. Flumazenil romacicon. Especially if you work in ER, you have to know your flumazenil romacicon antidote if somebody toxicity with Valium, right? Diazepam or Ativan, Lorazepam. So we use this Ativan Lorazepam for anxiety. It's your anti-anxiety to sedate the patient. Also treatment for status epilepticus. That's the seizures that non-stop more than 5 minutes. Okay, status epilepticus. So the drug of choice when somebody have status epilepticus is your Lorazepam, Diazepam. Okay, we can use for acute seizure control. Somebody suddenly seizure, give them Lorazepam. We also can use for people that alcohol withdrawal, right? Usually to calm them down, we can use your Diazepam or Lorazepam. And we give it intramuscular, IM, 90-degree, aspirate, right? You don't aspirate when you do the intradermal or subcute, but for IM, we do need to aspirate because we don't want to give the medication inside their blood vessel, right? We want intramuscular. But careful with this anti-anxiety here, right? Adverse effect can be apnea. Apnea, they stop breathing, right? So assess. Make sure you assess the respiration first before you give this medication. Because this is anti-anxiety, right? So if the respiration already low, don't give them this medication, right? You have to assess respiratory before you give the medication because this one can calm them down, right? So if they already really calm down, why you want to give this anti-anxiety, right? So don't give it if they have respiratory problem. Adverse effect apnea, cardiac arrest, bradycardia, hypotension, depressed, right? All the vital signs go down. Now they depressed, psychological, physical dependence, respiratory depression, right? Blood problem, nephrotoxic. So careful with the kidney. Check the kidney, check your BUN, serum creatinine, and creatinine clearance because Lorazepam also can cause nephrotoxic. Okay, So this is your anti-anxiety. Of course, if their vital sign already low, I will not give them this, because when I give them this anti-anxiety, their vital sign will go down. Okay, so assess vital sign before you give the medication. Now lithium. Lithium is your mood stabilizer, right? Mood stabilizer. I use this for bipolar manic. Do not take away salt from them. They need salt. Don't give diuretic with them, because then it will get out with the urine, right? So lithium for manic, need salt, mood stabilizer. Normal is 0.6 to 1.35. Very important to check, right? Usually doctor will order check every maybe once a month or twice a month, right? And why? Because if too low, not working, but if too high, then toxic. So toxicity when they tremor, right? So that's what you have to watch. When they toxic, they will have nausea, vomiting, diarrhea, slurred speech, tremor, ataxia means they cannot walk straight, right? They risk for fall, drowsy, muscle weakness, blurred vision, twitching. Of course, you have to report. That's already toxic. Of course, you have to hold your medication, because now you already give too much lithium, right? So nausea, vomiting, diarrhea, GI problem, slurred speech, tremor, ataxia, they cannot walk straight anymore, drowsy, very weak, sleepy, blurred vision, twitching, report to doctor. Hold your medication, report to doctor, already toxic. And then possible also other adverse effect can be renal failure. So you also have to monitor their kidney, right? Hypothyroidism can happen, serotonin syndrome, too much serotonin now, extrapyramidal syndrome also, right? And drug reaction with eosinophilia and systemic syndrome. Later, if you see DRESS, right? Don't forget this DRESS stand for drug reaction with eosinophilia. Eosinophilia is the too much eosinophil. Remember your white blood cell, you have eosinophil that will increase when parasite infection, right? So this can go up, the eosinophilia, and systemic symptom, the whole body, right? Systemic syndrome. So this DRESS stand for drug reaction with eosinophilia and systemic syndrome, systemic symptom. So DRESS can happen with lithium. All right, so monitor. I don't want any toxicity, and check the kidney. I don't want hypothyroidism, serotonin syndrome can happen, extrapyramidal syndrome can happen, not only with antipsychotic, it also can happen with your antidepressant, with your mood stabilizer. Also, this can happen, look like Parkinson, right? And then DRESS, drug reaction with eosinophilia and systemic symptom. Lithium. Don't forget they need salt. This is mood stabilizer. I use this for manic bipolar. Haloperidol. This is your Haldol. Usually if you have Alzheimer patient that combative, our drug of choice number one is Haldol, right? Because if you use Haldol, they still can function. If you use other medication, then they just sleep. You don't want to use something that make them sleep all the time, right? But Haldol, drug of choice when they combative. So this Haldol is your antipsychotic. There you go. We use for acute agitation. Somebody that suddenly combative, agitated, use your Haldol. But be careful, monitor the adverse effect, right? Side effect is anticholinergic, dry. So this is normal, right? But if the temperature go up to too high, of course you have to report, right? Dry mouth, drowsy, constipation, urinary retention, orthostatic hypotension. This is all because of the anticholinergic effect, right? We give it IM, so it fast, working really fast because they combative, right? So IM, possible they can have dizziness, headache, weakness, confused, anorexia, right? And if they use long term, they can cause a weight gain if long term, right? Anemia, neutropenia, that means it press the bone marrow, right? Because red blood cell go down, anemia, white blood cell also decrease, neutropenia, now they risk for infection, erectile dysfunction also, it affect their sex, right? And then amenorrhea, no menstruation for the ladies. Okay, so that's the side effect. Dry, anticholinergic, Haldol, antipsychotic. Okay, so teach them after the IM injection, usually just lay down for 30 minutes because they risk for fall. Okay, so after you give the injection, usually tell the patient to lie down, right? If this is your combative patient, after you give the injection, let them lie down for 30 minutes, right? To prevent fall. Now they risk for fall. And the adverse effect, I don't want this happen. Extrapyramidal syndrome again, right? Parkinsonism, neuroleptic malignant syndrome, that's very dangerous with vital signs go up very high. Also check their EKG. Torsades de Puentes, QT prolong again can happen with Haldol, agranulocytosis, they risk for infection, seizures. Okay, that's the adverse effect. So if you see those, of course, you have to report to doctor. Adverse effect of the antipsychotic Haldol. For people that combative, for people that acute agitation, right? Anticholinergic, dry, 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 dry. Psychotic. IM and then lie down 30 minutes to prevent fall. Haldol. Now let's talk about Quetiapine. This is your Seroquel, right? Seroquel, usually we use this for elderly, right? Children we use Risperidone, but the elderly we use Quetiapine Seroquel. So what is this? This is your antipsychotic. We use it for people that bipolar, right? This is your atypical antipsychotic. Okay, atypical. So adverse effect, extrapyramidal syndrome, neuroleptic malignant syndrome. Now they risk for suicidal, also DRESS, eosinophilia, right? And systemic symptom. Stephen Johnson syndrome, so be careful, check their skin. I don't want this happen, right? That's why tell them don't take herbal, don't take medication without doctor order, right? Because possible if they mix with other medication, they can have this Stephen Johnson syndrome. And then GI problem, GI obstruction, pancreatitis. So if this patient suddenly abdominal pain, tachycardia, of course report to doctor, right? Maybe pancreatitis because of this antipsychotic quetiapine. Agranulocytosis, they risk for infection, seizures. Okay, quetiapine antipsychotic. If they seizures, of course I will report to doctor, right? And now they risk for infection, so wash hand, monitor their temperature, monitor sign and symptom infection, ask for sore throat, right? But don't forget about pancreatitis. If they have abdominal pain, tachycardia, report to doctor. Maybe adverse effect of this quetiapine Seroquel. Valproic acid. This is your antipsychotic, but also your anti-seizures, right? You also can use for anti-seizures. So valproic acid. Careful with extrapyramidal syndrome, right? When you give this, no wonder doctor usually also will give medication that anti-Parkinson together with this, just prevention for the extrapyramidal syndrome. So valproic acid, it's your anti-seizures, right? Anti-seizures here. Careful, the adverse effect also DRESS, eosinophilia, systemic symptom, hepatotoxic. Ooh, that's always in the test, right? Monitor the liver, SGPT, SGOT, ALT, AST. I don't want to see jaundice, right? So hepatotoxic. And then pancreatitis, I don't want they suddenly abdominal pain, report to doctor. Metabolic acidosis, so the pH low, the HCO3 also low, metabolic acidosis, right? People that metabolic acidosis, they have to hyperventilate, right? To compensate, don't forget that. Metabolic acidosis can happen with this valproic acid, okay? So it's acid. Thrombocytopenia, now they risk for bleeding. Leukopenia, they risk for infection. Hypothermia, temperature go down. Hyperammonemia, so the ammonia high in the blood, that's not good. It will affect their brain, right? Suicidal thought and behavior can happen, okay? So monitor your valproic acid, especially hepatotoxic, pancreatitis, metabolic acidosis. Alright, so assess. Nurse, watch out. Don't let them suicidal. Don't let them kill themselves, right? Monitor pancreatitis, that's our job. DRESS, fever, rest, lymphadenopathy, right? Enlargement with the lymph node, eosinophilia. So check their lab, right? You don't want to see the eosinophil high, report to doctor, maybe effect of this valproic acid. Hepatotoxic again, discontinue if you see those sign and symptom or lab, right? And report to doctor. And monitor overdose, because when they overdose, then the CNS depress. Drowsy, confused, ataxia, they cannot walk, right? Nystagmus, involuntary movement with the eye, diplopia, double vision, dysarthria, pronunciation is bad, right? Dysarthria, difficult to pronounce the word. And then tremor, coma, that's bad. And then monitor hepatic enzyme, ammonia, don't forget, right? Ammonia. Remember, medication to bind ammonia is your lactulose, right? And then check the CBC, platelet, because they can go down. Bleeding, that means the thrombocyte go down, right? So assess before and also periodically during the valproic acid. A lot of problem here. Hepatotoxic, pancreatitis can happen, and all the white blood cell can go down, thrombocyte can go down. Lamotrigine, anti-seizures, right? Lamotrigine. And this one you can use it for pregnant woman. Don't use Phenytoin for pregnant woman, right? So Lamotrigine, but Lamotrigine, be careful with rash. So if they have rash, you have to report because the rash can be life-threatening. Okay, Lamotrigine, anti-seizures. So safe for pregnant woman, but if there is rash, you have to report to doctor quickly, life-threatening. Okay, so it's warning, really important. That's why the test always asks you this. I don't want any rash. It can be very serious, right? Especially the Stephen Johnson syndrome. Lamotrigine. They also can have suicidal behavior, cardiac arrest, so you have to monitor their EKG, also DRESS, eosinophilia with the systemic symptom, right? Hepatic failure, so check the liver also, and then hemophagocytic histiocytosis, right? So the lymphocyte will go up, the phagocyte cell also problem here, right? So something that eat the germ, right? Phagocyte, and then but this one eat the blood, right? And then aseptic meningitis can happen. Meningitis. Okay, adverse effect. But especially the one that always in the test, be careful with the rest, and pretty safe for pregnant woman. This is your anti-seizures. Phenytoin, there you go. Anti-seizures, right? This one usually, don't forget, it can cause gingival hyperplasia, right? So it's overgrowth of the gum, and the urine can be brown color, dark color for phenytoin. 10 to 20 is the lab value for phenytoin, right? So anti-seizures, don't use it for pregnant woman. Don't forget 10 to 20, right? If too low, not working. If too high, they will toxicity. So your side effect, lethargic, tremor, nausea, vomiting, right? GI problem, agitated, confused, dizzy, extrapyramidal syndrome, right? Look like Parkinson, drowsy, headache, insomnia, vertigo. Some of this already adverse effect, right? I will report to doctor. And then fever, hypotension. There you go, gingival hyperplasia. It's not life-threatening, but the gum will be very, very big, right? This is the overgrowth of the gum. Many children, if they always take anti-seizures like this, no wonder their teeth is very, very big, right? The gum is very big. So gingival hyperplasia, they need frequent oral care, right? Sugar can be high, report. And then the urine, there you go. This is normal. The urine can be pink or red or brown. But this is harmless. So you tell your patient, right? If you take this medication and now your urine usually brown color, that's normal. That's effect of the medication. But if you suspect maybe this is hematuria, then report. Okay? Because usually brown color. Adverse effect, I don't want toxicity, too much phenytoin, right? Nystagmus, involuntary movement with the eye, diplopia, double vision, ataxia, they cannot walk anymore, slurred speech, of course, report. Cardiac arrest, the heart already stopped. Dysrhythmia, irregular heart rate, so monitor your EKG. Hepatic failure, affect the liver also. Stephen Johnson syndrome, DRESS again, eosinophilia, right, with the systemic symptom, granulocytosis, now they risk for infection, teach them to wash their hand, right, angioedema, they cannot swallow, the lip swollen, of course report, this is ABC problem, osteomalacia, so the bone becomes soft, suicidal thought, okay, phenytoin, anti-seizures, right? So this one, don't use it for pregnant women. Gingival hyperplasia, brown urine, but harmless. Teach them it will happen. Memantine. What is memantine? I use memantine for Alzheimer, right? This is your Alzheimer medication, memantine. So Alzheimer. When they use this, they can become dizzy, confused, fatigue, headache. So teach the family, right? The patient get memantine, possible effect of the medication, dizzy, confused, fatigue, headache, diarrhea, weight gain, urinary frequency, right? So we have to monitor the renal function, right? Because this medication can cause them pee a lot, urinary frequency. So please monitor their renal function. Adverse effect, I don't want this happen. The BP can go up, hypertension. They also can have rash because of memantine, anemia. Now they fatigue and chills can be effect from memantine, right? But do not stop immediately. Do not stop immediately. And this one you can take with food or no food, no problem, right? Memantine. Do not stop abruptly. Make sure to monitor renal function for memantine, and you can take it with food or without food, no problem. For memantine, Alzheimer. Now Donepezil. So Donepezil also your Alzheimer medication, right? For people that Alzheimer. Usually we give Donepezil and Risperidone together because they work better, agonists. Just like levodopa, carbidopa for Parkinson, we give them together because they work better, right? So for Alzheimer, we give this Donepezil, right? Together with Risperidone. So Donepezil, this is your Aricept, right? Side effect can be allergic, diarrhea, nausea, vomiting, anorexia, so your GI problem, right? They don't want to eat, so what's their weight? It can decrease. Frequent urination also, don't let them fall, right? Weight loss, hot flashes, muscle cramp, headache, vivid dream. So possible maybe that vivid dream, maybe because of the Donepezil. Okay, and then the adverse effect, atrial fibrillation, that means monitor their EKG, hypertension, BP can go up, but bradycardia, right? So this one, the BP go up, but the heart rate go down. So careful with Donepezil. I don't want bradycardia because when they heart rate too low, now they have dizzy, now they fainting, right? Don't let them fall. So hypotension. So can be hypertension, can be hypotension. What does that mean? Monitor their BP, monitor their heart rate. So assess vital sign and report if there is adverse effect. Okay, BP can go up but also can go down. Of course, the one that very dangerous, the one that low. So bradycardia, hypotension. Donepezil, Alzheimer patient. Okay, monitor your vital sign. Naltrexone. This is Naltrexone, not Naloxone. Do not confuse Naltrexone with Naloxone. Okay, Naloxone is the one that Narcan for opioid overdose. This one Naltrexone. Usually we use Naltrexone for people that alcohol withdrawal, right? Naltrexone. But you cannot use this for reducing the tremor, right? It only can reduce the craving, right? The craving for the alcohol, but also for smoking. So Naltrexone is your opioid antagonist. So the opposite, right? The opposite from opioid. It blocks the opioid receptor, prevent the euphoric and sedative effect of opioid. So that's why I can reduce craving to opioid and alcohol. Okay, it's not for overdose. This one to reduce the craving to the opioid and alcohol. Even for the smoking also you can use this to reduce their craving. Opioid antagonist, against the opioid, the opposite from the opioid, but we use this to reduce the craving to opioid and alcohol. Side effect, they can have headache, anxiety, joint and muscle pain, abdominal pain, nausea and vomiting. So tell the patient, possible if you take this medication, Naltrexone, you can have a GI problem, right? Nausea, vomiting, abdominal pain, but of course if it's severe, they have to report, right? Headache can happen, maybe feel anxiety, joint and muscle pain can happen. Check their liver because the adverse effect is hepatotoxic. Check their ALT, AST. They can feel depressed, suicidal, right? careful with their liver, careful with their kidney, renal disorder. Monitor their BUN, serum creatinine, and creatinine clearance, right? BUN normal 10 to 20, serum creatinine 0.6 to 1.35, creatinine clearance 125, 132. So monitor those. Don't give to patients that already have liver problem and kidney problem. And adverse effect also the client with dyspnea and hypoxia. Oh, don't give it to people that already have problem with breathing and hypoxia. Okay, naltrexone to reduce their craving to opioid and alcohol. Naltrexone, not naloxone. And this one is hepatotoxic. Check their liver, check their kidney. Don't give it if patient have kidney problem, have liver problem. Naloxone. Now this is naloxone. Now this is Narcan, right? For respiratory depressed because opioid toxicity. So this is your Narcan, naloxone, but short half-life. So that means it work very short time. So this is your opioid antidote. It's your opioid antagonist, right? It can be IV, IM, subcute, intranasal, so it can work really fast, right? IV is the fastest. And there you go. The doses may need to be repeated because of the short half-life, right? It means it go away really fast. So sometimes you need to repeat if the respiratory is still depressed, right? So larger dose may be needed to counteract with opioid antagonist medication. So just follow doctor order. Sometimes doctor will give larger doses. And the one that intranasal, if via the nose, it can be given every 2 to 3 minutes if needed, right? So it's normal. Sometimes we have to give it again for this naloxone because of the short half-life. And as alternate the nose for IV bolus, usually you give the dose undiluted over 30 seconds with opioid toxicity, right? If they have opioid toxicity, IV for RN here, IV bolus undiluted over 30 seconds. And then for opioid that induce respiratory depress, dilute with the sterile water and give it as at prescribed rate. Always follow doctor order. Prepare for potential repeat administration because of the short half-life, right? So follow the facility guideline, follow what doctor tell you, right? And then excessive dose for post-op client can result in tachycardia, fibrillation, seizures, hypotension, hypertension, pulmonary edema, pain, and excitement. All right. So the most important, remember naloxone. I use this for respiratory depress because of the opioid, but because of the short half-life, maybe doctor will tell you to repeat the dose. Follow doctor order. Methadone. Methadone to replace heroin. Usually to replace heroin, right? Sometimes mama that pregnant addicted to heroin, and then when the baby born, jittery, right? And sometimes we have to give the baby methadone until finally, in the beginning we give the methadone until they not jittery anymore, and then every day we reduce the dose a little bit until finally zero, right? When it's already zero, then the baby can go home, right? So this methadone to replace heroin. So this is your downer. It can make your vital sign go down, right? Methadone for opioid use disorder, people that heroin, it's your opioid agonist, right? Nurse assess their vital sign, BP, pulse, respiration before and during administration, right? So check their blood pressure, check their vital sign before you start and during the medication. Why? Because it can cause hypotension, right? It's bring it down. It's downer, hypotension. And when they overdose, the pupil will be pinpoint, correct? Don't forget, when somebody overdose with a downer, opioid, alcohol, hydromorphone, fentanyl, all this downer, when they overdose, pinpoint pupil. So BP can go down, hypotension, constipation, confused, sedation, right? So be careful, risk for fall, give it at night, right? So monitor sedation level, abdominal status also. So adverse effect, respiratory depress, of course I don't want that happen, right? When it happen, then they need naloxone, right? And then QT prolong also with injection, so you need to monitor their EKG. So the QT also can prolong because of methadone, means the ventricle contract longer time, right? And remember, for methadone, you cannot stop abruptly. Do not stop abruptly, right? Teach the patient cannot stop methadone abruptly. Disulfiram. This is for people that alcoholic and they come to you and say, can you help me? I know alcohol is not good. Can you help me with something? And then you can use this disulfiram therapy if doctor order, of course, right? And the rule is the first 12 hour, no alcohol at all. Later, when already past 12 hour, if they survive no alcohol, then we can start the therapy. And we have to teach them, right? When you buy something OTC over the counter, always read the label, because if they touch any alcohol, they use mouthwash, they use shaving cream that have alcohol, maybe alcohol wipe before injection, they will have severe nauseous, right? GI problem. Nausea, vomiting, diarrhea can happen, especially very, very nauseous. So that's disulfiram reaction. And then if they already take the medication and if they want to drink alcohol again, tell them you have to wait for 2 weeks, right? Because the medication already in the system. So if they drink alcohol too early, then they will have severe nauseous, right? So this is disulfiram or antabuse. So it is your alcohol deterrent to stop alcohol, right? For people that are alcoholic. And how they work, they inhibit this enzyme here, aldehyde dehydrogenase, so the enzyme. It increases this serum level, acetaldehyde, when the alcohol is consumed. No wonder they become very, very nauseous, right? So if they drink alcohol, it will increase this level of the serum acetaldehyde in the blood. Okay, so teach them when you take this medication, you cannot touch any alcohol at all. As moreover, you drink that, right? Because then you will have the patient will have severe nauseous. Do not touch or drink any alcohol. Severe nauseous problem. All right, and also here, at least 2 weeks after you take this medication. Okay, if you want to drink again alcohol, avoid to use alcohol-based hand cleanser, so including the sanitizer. Okay, lotion, cologne, rubbing alcohol. So all of this, whatever that have alcohol, they can have diaphoresis, cold sweat, nausea, hypotension, tachycardia, palpitation, right, dyspnea, vertigo, facial flushing that can happen when they touch alcohol. Right? So what is the goal? The goal is they don't drink alcohol anymore. We use this medication, of course, the outcome that we want to see, finally they free from alcohol, they will not drink alcohol anymore. That's the goal of this medication, disulfiram antabuse. All right, almost done, right? Isocarboxide, very famous, always in the test, right? And what is this? This is one of your MAOI. Please remember your MAOI. You have phenelcine, tranylcypromine, and isocarboxide. Alright, this is your MAOI. Don't give them high tyramine diet, aged cheese, sauerkraut, homemade bread, right? So it's here cheddar, old cheese, right? Brie, parmesan, something that already old with this cheese, right? Cured, marinated food, smoked food, aged meat, salami, pepperoni, pickle, fermented food, sauerkraut, soy sauce, miso, right? Fava beans, yeast extract, marmite, right? So if they take this homemade bread, right, avocado also, they can have a hypertensive crisis. BP very, very high, they can have stroke, right? So avoid high tyramine diet with R, not thiamine. Thiamine is vitamin B number 1. This one is high tyramine diet, MAOI. It's antisocial, don't take it with other meds, right? So teach your patient MAOI, phenelcine, tranylcypromine, and then isocarboxide. Memorize always in the test, right? This is your antidepressant. Don't give it with other meds. Don't give it with SSRI. They can have serotonin syndrome, right? So your phenelcine, tranylcypromine, isocarboxide, that's your MAOI. Avoid high tyramine diet. They can have hypertensive crisis. aged cheese, marinated food, pepperoni, salami, fermented food, right? Smoked food, avocado, all this sauerkraut, homemade bread. Okay. There you go. Chlordexepoxide. Chlordexepoxide. Also always in the test. Chlordexepoxide. This is your Librium. So this is for alcohol withdrawal, right? Alcohol withdrawal. People that alcoholic, if they don't drink alcohol in 6 hours, they will have sign and symptom, alcohol withdrawal. Suddenly they tremor, they can have seizures, so safety. They can have hallucination, delusion, right? That's your alcohol withdrawal. Chlordexepoxide is your number one choice for alcohol withdrawal. Okay, it's your benzodiazepine to calm them down. So if you don't have this chlordexepoxide, you also can use diazepam, lorazepam, right? So use this for short-term management anxiety and acute alcohol withdrawal symptom. But if they have sedation and confused, right? So you have to assess the respiration and autosat. Okay, if you see your patient sleepy and confused, check their respiration and autosat and report to doctor if not normal. Okay. So chlordexepoxide, Librium, this is for alcohol withdrawal. Okay, alcohol withdrawal. Tremor, seizures, vital sign go up, hallucination, delusion. Because they usually alcoholic, they don't drink alcohol in 6 hours. They can have this withdrawal symptom. Give them chlordexepoxide. If you don't have it, give them benzodiazepine, diazepam, lorazepam. Last one, right? Nicotine replacement therapy. Some people smoking. They want to stop. How to stop, right? You can use this nicotine replacement therapy. All right. Medically approved. This is the method to help people to stop smoking or vaping also. You can use this nicotine replacement. It's controlled low dose nicotine without toxic chemicals in the tobacco, right? So nicotine replacement actually is low dose nicotine without toxic chemical. But you have to monitor for toxicity if they use it too much, because now the vital sign go up, tachycardia, headache, they cannot sleep, right? Side effect, nausea, hiccup can happen. So tell them possible because of this medication. The skin irritation, vivid dream also can happen because of this nicotine replacement therapy. Mouth sores, right? Jaw pain. So tell them this jaw pain, maybe they chew the gum too fast, right? Don't chew the gum, because it's usually this medication is like gum. So tell them just normal, don't chew this medication too fast, because if they chew this too fast, then they can have jaw pain, right? Sore throat can happen, also nasal irritation. And don't stop immediately. Do not stop immediately for this medication, nicotine replacement therapy. Okay, this one for people that want to stop smoking or vaping. And actually inside the medication, it is some nicotine but low dose, right? Without chemical that dangerous. Okay, so low dose nicotine without toxic chemical. But watch out for toxicity. When the vital sign go up, headache and cannot sleep, that's already toxicity. And pretty normal side effect, nausea, hiccup, right? The skin irritation, vivid dream can happen, mouth sore, jaw pain. So we have to teach the patient. We teach this person who use this nicotine replacement therapy, don't chew the medication too fast. Okay, if you chew the gum too fast, then the jaw pain can happen, sore throat, and irritate the nose. Do not stop the medication immediately. All right. So these are the sample of the medications that can affect your CNS and PNS medication. Hopefully it's helpful for you. Listen again repeatedly so you can remember the information. All right. Take care. God bless. See you next time for another YouTube video. Bye.